All right, thank you. I'm excited to be here. Excuse me. My name is Jenna Lohnes. I am a child and family therapist with WV Medicine. I work primarily with young kids and families. I love it. Um, and I've kind of moved into specializing working with kids who have had early trauma, abuse, and neglect. I work with a lot of families or foster families, adoptive families, and also families in recovery. And what I love most about my work is this idea of relational repair. How can we strengthen families wherever they're at so that their relationships are stronger and the outcomes for these kids, for these parents, are good and positive. So you're going to hear that throughout the presentation. I think the title that was given, which is totally my bad, I forgot to change it, was Attachment and Child Development. We're going to talk briefly about attachment. It's going to be throughout, but what I really want to talk about is this idea of disruptions and repair. You'll notice that Dr. Swagger is also on this title page. She helped create some of this content, so I want to give her credit, especially at the end when we talk about how can we have strong hands within the child welfare system. That's her wheelhouse. She created a lot of that content and cannot be here today. Okay, we're going to start. Today, we hope to learn a little bit, understand a little bit more about how attachment develops, what happens when attachments are disruptive, it's not good, and how can we nurture relational repair, and specifically with kids and families within the child welfare system. So attachment is one of those words, it's pretty buzzy. I hear it a lot. What the heck does it mean? I'm not sure. I often have to really think about, okay, how am I going to explain this? Because it's such a big concept. Um, it's a confusing term because it can mean different things to different people. But really, attachment is about our experiences. And not just any experiences, specifically the experiences we had early in childhood with our parents, with adults and caregivers. Um, those experiences influence me now, how we relate to others, to each other, and they shape our future experiences with people based on what kind of assumptions we're bringing in. Um, it impacts how we think about ourselves, what we think about others, and how we can be in relationship with others. So, a quick example. Hypothetically, maybe I was a little nervous this morning thinking about this presentation, getting in my head like, ugh, I underprepared. No, I overprepared. I have too many slides. So I'm feeling a little anxious, insecure, maybe vulnerable. Vulnerability is one of those emotions that if you're wondering, what is my attachment like? Pay attention. When you feel vulnerable, it's going to give you good clues. So I'm feeling a little, and I think, okay, I'm going to reach out to my partner, to my husband. He's a good guy. He's been there for me. I have all these experiences with him of being positive. So maybe I text him. He actually has his own presentation this morning. And I'm like, oh, I'm feeling nervous. And he responds with a predictable, like, you got this. You know what you're talking about. Just do your thing, Jenna. Okay, that feels good. Well, maybe I can't get a hold of him. So then I'm like, okay, all right, I can do this. But oh, I feel nervous. I just need that affirmation. So maybe I text Amanda, who's here today, right? I've known her a long time. She's always been super encouraging to me. I text her and I'm like, oh, I feel nervous. And Amanda is like, you got this. You're so amazing. I'm like, okay, got it, right? I am not gonna text Teresa, who's on this call. I have never met Teresa. I'm not gonna text her, right? I have no experience of her being supportive to me. I might assume she is because that's just kind of my assumption about people, but I'm probably not gonna reach out to her, right? That feels weird. I'm not gonna do that. I am not making these decisions in a vacuum, right? This is a part of my attachment history. Like, I believe that my people that are close to me are going to be there for me, and I'm reaching out with that expectation. I'm not reaching out to strangers because I have this intuition that that's a little creepy and weird. I'm not going to do that. All of that comes from our attachment. Where does it start? It starts in the womb, and it's based on really millions of little experiences between an infant and a caregiver that says again and again, I got you. I see you. I'm taking care of your needs. It's hugely important in those first few years of life. It lays the groundwork and kind of the mapping of how we exist in relationship to other people. It's the nonverbal glue that's transmitted from parent to child. It is a felt experience. Attachment is not a teaching moment. It is not, you can't talk someone into feeling safe most of the time. You need to have those experiences of feeling safe. I used to have about 5 slides on what attachment is until I learned about the circle security. I think Dr. Khan presented here a couple of months ago. So, and I love this visual of how attachment develops. It is this circle, and the most important part are those hands, those strong, sturdy, warm, kind hands. That's the adult. That's the adult. And from those hands, kids go out and explore, and their hands are cheering them on as they try new things. They're saying, not that, don't touch that. And they are welcoming the kid back in and comforting, protecting them, delighting in them. Repeat again and again. Every time we do this, that attachment, that healthy attachment, is strengthened. The circle is nice and tight at first, right? Babies, how they explore, they're like looking away and then looking right back at you. That was a circle right there. It's really small. And as kids get older, we let them go farther, and that circle gets bigger. Also, those hands, there's more of them, right? Initially, it's just the caregivers, maybe even just mom right in the beginning. And then it gets bigger, right? We have close friendships. We have coaches, maybe we're close to, religious figures, pastors, partners, friendships. We get more and more hands. Generally speaking, the more sturdy hands kids have, the better. Can't really have too many hands. Attachment behaviors serve different functions, right? We know this, especially it feels very intuitive with little ones. We have signaling behaviors. Those are the really cute ones. Aversive behaviors are the not cute ones, right? Kicking, screaming, crying. But with little ones, right? When we have a baby who's kicking their legs and screaming, right? We don't think, oh, that baby is so oppositional. Ugh, like he's being so defiant right now. We think, oh, you need your diaper changed, or oh, you're hungry, right? We assume there's a need underneath this obnoxious behavior, right? In fact, that's why they have the obnoxious behavior, to get our attention. It works really well most of the time. And I'm going to have you remember that, because when we talk about attachment interventions, we are going to try to remember what it was like when they were little and bring that same curiosity and that same assumption that, okay, these behaviors mean something. I need to pay attention here. They mean something. And I probably should have admitted to this in the beginning, but this whole presentation is a little bit of a thinly veiled attempt to convince everyone that we need more attachment-based interventions within the child welfare system. So I'm really going to be pointing that out. So attachment behaviors, the assumption, they serve a need. They serve a need. They are not oppositional. They're normal. They're normal. And our job is to figure out what that need is. I'm not going to go through all these behaviors. What I want to point out is their purpose, right? The purpose is really, these are, a lot of them are skills that are being built in kids, and trust and safety, um, independence, right? That's a skill, learning that I can do things for myself. As they get older, that confidence in relationships and emotions, knowing that, okay, emotions aren't so overwhelming and I can actually start to name them, to express them in different ways outside of behaviors. Social skills is a big one. And practicing adult relationships as they get older. Testing limits, figuring out what I can and can't do. All of these happen in relationship to caregiver, and they are practice, they are skill building, they serve a purpose. So why does this matter? Well, if you think of my earlier example with feeling nervous or insecure about my presentation, reaching out to my partner, reaching out to friends or colleagues to get the support that I need to do this, right? There's a lot of assumptions that I'm totally taking for granted, right? First off is that I feel discomfort and I can do something about it. That's a huge assumption, right? I can do something about my discomfort. It's not hopeless. Not everyone has that assumption. The other one is I can reach out. I can reach out to somebody because I'm cared for. I'm loved. And I just kind of know that. So it doesn't feel dangerous or scary to reach out. That's a huge assumption as well. I'm loved. Somebody will take care of me. I only have those assumptions because I have the experience of that happening multiple times before. So our attachment experience inform our internal working model, which is this fancy way of saying it's this lens of how we relate to others, what we expect from others. And because we're social creatures, right, what we expect from others directly communicates something about ourselves, right? If others have not taken care of us, then we tend to think we're not worth being taken care of. And it anticipates future interactions, right? If I think people aren't going to take care of me, then I am looking for evidence of that to be true. I'm noticing every time I get a weird look or somebody doesn't respond to me right away. Maybe Amanda takes a little bit of time to text back to me and I'm like, oh, she hates me. Right? I'm looking for evidence of that to be true. An attachment lens, when we talk about attachment interventions, attachment strategies, it's going to pay attention to a child's cues with that deeper understanding of what the child is also asking. Simple example. A kid is like, give me juice. I need juice, right? They need juice, probably. They want the juice. That's the surface behavior. Cool, you need juice. There's also a need underneath that's saying, will you meet my needs? Will you listen to me? Will you take care of me? Are you trustworthy? An attachment perspective is going to pay close attention to that. So what happens with disruptions? like I said, they're not good, right? Disruptions are when our hands are wobbly, scary. Those strong, warm, open hands, they're not. Maybe they're scary. Maybe they're really unsteady. And maybe sometimes they disappear. And sometimes within the child welfare system, they're replaced altogether, right? And we get these strange new hands that we're just supposed to trust right away. And we have no experience of those hands. Those are all attachment disruptions. And they can have some really negative impacts on kids. When hands are wobbly and scary or have been replaced with strange hands, the skills, those lovely skills that we saw when we were talking about attachment, right? Trust and dependence, those get underdeveloped. They get underdeveloped. And survival skills get overdeveloped. And those survival skills often look like aggression, defiance, oppositionality. They're usually not the behaviors we want in kids. So when we're talking about disruptions, we're talking about any physical separation from a caregiver, and this can be for a lot of different reasons. It can be due to loss, to death, prolonged periods away. Divorce can feel like, oh, these two steady hands are now really wobbly and fighting. Residential treatment, right? Kids being removed and being away from caregivers for prolonged periods of time, being in the foster care system, having multiple placements within the system. Neglect, those hands are not sturdy or just not there. Trauma, abuse, or neglect, hospitalization, kids who have prolonged periods in the hospital. We also see these attachment disruptions. Impacts of attachment disruptions. You guys know this, right? It's not good. We see it in almost every area of a kid's development, especially relationally, right? These are often kids who struggle with interacting with other kids appropriately. They have a ton of behavioral issues, and that's usually what we see first, right? That's the kind of primary complaint. But if we could peel back those behaviors, we'd also see kids who are very scared, struggle to trust adults, who fear being abandoned, and really struggle with the sense of their own worthiness. So attachment styles are kind of in vogue right now. I'm not going to go into them, but I want to point out that for disorganized, which is the attachment style that has kind of the poorest outcomes, for the general population, it's really low. Only about 5% of us have a disorganized attachment. In the child welfare system, that goes up to about 80%. So again, when we're thinking about, okay, how do we meet these families' needs? How do we meet these kids' needs? And 80% of them have a disorganized attachment, meaning they really struggle to trust adults. They really struggle relationally. Our intervention, our strategies need to include relational repair at their core. And right now, our system really emphasizes behaviors, right? We have behavior plans, we have behavior approaches, and an attachment perspective is going to really point out that behaviors, that's up here, that's a superficial thing, right? We're going to translate those behaviors into, okay, these are attachment needs that we need to meet. So if we respond only with behavioral approaches, we miss a lot of the underlying needs. Behavior approaches are absolutely helpful, and we need them to stabilize systems, to add predictability. But we can also end up reinforcing that negative attachment message that kids already have, which we don't want to do. No one wants to do that. So for example, in that earlier example of the kid who's like, give me juice, I need juice, right? He's being a little demanding. So we might be tempted to be like, oh, no, mister. You change your tone first. And if you don't change your tone, you're not getting the juice, right? We did not reinforce that demanding attitude. Good job. But if the kid is actually saying, you know what, I've had to be really loud and demanding in the past to get my needs met, so I'm yelling here because that's what I know what to do. I need juice. And is asking, will you take care of me? Will you meet my needs? We just said no, right? We just said, nope, not taking care of your needs. You got to change your little attitude first. Does this kid know how to change their tone, right? What's the bigger need here? An attachment perspective is going to help us see that bigger need. And bonus, it also helps with the behaviors. So relational repair is where I want to lean in next. And we're going to use circle security language of strong hands. And when I say strong hands, they're strong, but they're not scary. They're sturdy, they're warm, they're open, they're consistent, and they are ready to carry kind of the heaviness of what our kids need. So in our response, strong hands. This is not always intuitive, right? Just giving a kid, okay, here are safe hands now who are in charge of you, right? That's often not enough. It needs to be taught, modeled, and practiced and supported. How do we do that? Attachment focused lens throughout. So it recognizes that attachment disruptions, there needs to be a component of relational repair, not as an afterthought, but as a central part of treatment. So if a kid is in the child welfare system, we assume that there have been attachment disruptions because there have. Even with kinship caregivers, right? They're learning a new set of hands in a different capacity. Let's bring in that attachment approach. There's a lot of evidence-based models that we could use. Parent-child interactive therapy. These first 5 are all therapies with a parent and child together, where we're working on behaviors, we're working on all the things, but we're doing this together and strengthening their relationship. The last 2 are reflective support and education groups. So parents can get that practice away from their kids, but also get support from each other. And then also thinking of relational repair as prevention. If we embed these in our current systems, we can prevent behaviors from escalating. We can prevent parents from burning out, foster parents from burning out, because we're meeting this need from the beginning. Visitation is highlighted as really a great opportunity. I'll touch on it in the next slide to practice some of these strategies with parents directly. Keeping kids connected to their original families when removed, as long as it's safe, can really help strengthen that connection with their past hands. Strong hands throughout the child welfare process. This is meant to be kind of a practical slide. There's a lot of text here, so I'm just going to highlight the main pieces. How can we help those of us who are directly involved with kids in the child welfare system? How can we be strong hands? What does that look like? And how can we facilitate that for the kids and the other adults in their lives? So first, the adults need to be reliable narrators of the world, right? Being vague with kids is generally not helpful. Being trying to smooth hard things over with, oh, it'll be fine, when we have no idea if it'll be fine, is generally not helpful. If we're going to be trustworthy, we have to tell the truth in age appropriate ways. We have to handle hard questions and answer as honestly as possible. I don't know is a valid response. And being with the discomfort of it's so hard to not know is enough. And we can do that. Encouraging the child to ask questions. Kids are really good at asking questions at a pace that feels good to them. Let them. Give them the answers that we have that are age appropriate. An appropriate level of care. This one is hard and really important. I know our state has limited resources, but appropriate level of care is huge. Group homes, residential care, from an attachment perspective, it's the worst place for a kid, right? We are just removing any safe hands from their life and putting them with other kids, right? Kids learn best in one-to-one relationships, not in groups. And especially if they're 11 or younger, it can be really harmful. There's all kinds of risks of increased behavioral and emotional challenges. And a lot of time kids are placed in group homes, it's for safety, right? We don't have any other alternatives. Group homes are often not the safest place for kids. Kids are much more likely to be sexually assaulted, hurt, have violent experiences, much more than the general population, and a chunk more than in foster care. So are these really safe alternatives? It's worth thinking about and considering. Family-based care is always going to be the best option in terms of attachment. Visitation. This is a great opportunity within the child welfare system to foster that connection. We want to develop appropriate trauma-informed rituals, right? It would be awesome if visitations could look the same, kind of have a beginning, a middle, and an end each time. That feels really comforting to kids. Separating a visitation from improvement period milestones, right? If connection and attachment is one of our treatment plan goals, then visitation happens regardless, right? It's part of our treatment plan. If visitations get canceled, I hear that happens often. What's our plan? How do we grieve this with the kid? How do we be sad and then do something else? And being creative in how we do visitations. A lot of unstructured time is generally not helpful. We want to structure the play. We want it to be meaningful. And parents often need help with this. They need it modeled. They need some ideas, and we can do that. Okay, we're at 10:34. I'm going to stop here and see if there are any questions or thoughts that people have.